There. Joining us now for more on this is Dr. Curry-Winchell. She is a physician and health equity advocate. Doctor, good morning. You know, a recent study published in the journal Science Direct found 84% of Black women from 2014 to 2022 reported current or past use of these hair relaxers. So let's rewind a bit. How do these hair relaxers and chemical straighteners work?
So a relaxer, chemical relaxer, is basically a lotion or cream that's applied to the hair, and that breaks down the protein or the curly aspect of the hair and causes it to be straight. Now, it doesn't change until that hair regrows. And so when we talk about the Black community, as those women mentioned, there has been a historical use of these products to really change our hair into a straight product.
As we heard Clay mention, their studies have linked the chemicals in these hair straightening products, like formaldehyde, to an increased risk of cancer. What can you tell us about these findings?
So this study was really compelling when you look at the fact that approximately 60% of those that participated were linked to uterine cancer. And so when we talk about these chemicals and the fact that this study identified a strong correlation, as well as the fact that a specific group primarily used it, it's a strong finding that, you know, there is a possible link to cancer when you look at these products.
It's so interesting because in recent years, we've seen really a boom in the natural hair movement, right, among Black women. What do you tell women who have used relaxers but have now stopped? Do you think they still are at risk?
I do. So I think it's really important. Although you stopped using that product, still are a possibility of long-term effects. So really making sure that your health is at the forefront, because we know these products are linked to breast, endometrial, uterine cancer. And so although you may not have any symptoms now, down the road, it could present. So I tell every woman to continue to invest in their health and make sure that they get checked out.
What are some safer alternatives for people who want to continue straightening their hair, but they don't want the risk of being exposed to those chemicals?
So the big thing is to look at the ingredients. The more you know about what you're applying to your scalp, to your hair, is vital. And so a lot of my patients still want to, relax their hair. So as long as you know what's in that ingredient, that allows you to decide if you want to take that risk based on those chemicals. Another thing that's helpful is there's an environmental working group that really displays all of the chemicals that are in hair products. And so that's another thing that women can look at if they decide to straighten their hair.
Dr. Curry-Winchell, really important information. Thank you so much for joining us this morning.